Hello, Professor Kappelle. You're a neurologist. Can you tell me something more about your field of expertise?
Sure. I'm a clinical neurologist, and I'm working in the University Hospital in Utrecht in the Netherlands. And my field of interest and my clinical work is mainly focused around patients with cerebral ischemia, brain ischemia, patients who have complaints with of problems with too short of blood in the brain. And they come to our clinic, and they can come to the outpatient clinic, or they can come to the clinic itself if they have very severe neurological problems.
On that note, could you tell me more about what kind of patients do you see?
Yeah, I think it's in this context, it's good to focus on patients with so-called TIAs. And TIAs, most people have heard about this diagnosis. It's the abbreviation of transient ischemic attack, which means that there is a temporary blockage of one of the arteries in the brain, which means that there is at that time there's a part of the brain that does not receive enough blood. And of course, the brain does need blood because it needs oxygen. And the brain is very, very vulnerable. So if there's only a short moment of lack of blood, then the brain will not function anymore as it should do. And that means that the patient will get, at that time, will get symptoms. And these symptoms are dependent on the location of the shortage of blood in the brain. If it's in the part, for instance, where you generate your language, then the patient is not able to speak anymore, to talk. Or is it in the area of where you receive your visual input, then the patient cannot see good enough, or the patient, if it's in the motor cortex, the patient cannot move its arm. Or if it's transient, then these patients usually have these symptoms for a short while and then recover. And then they come to my clinic and they tell me, well, yesterday I noticed that I had for 10 minutes, I could not talk anymore. And then I have to find out what's the reason and what I should do for these patients.
So you already started introducing symptoms for a little bit. Could you tell me more about what are the most common symptoms that patients with TIA experience?
Yeah, well, the most important thing is that these patients do have a sudden onset of deficit. As I just mentioned, the brain is very vulnerable. So if there's a blocking of an artery, of an important blood vessel, then there's a sudden onset of deficit. And these deficits, they can that can be what we call in our jargon hemiparesis, which means unilateral weakness of one side of the body, which means weakness of the left arm or together with the left leg. And sometimes the patient also tells us that there is a asymmetric corner of the mouth, and then there's as we call it, hemiparesis. And sometimes the patient can also not feel good on the half side of the body. So if you give them a kind of stimulus, then they cannot register that in a good way, and they do not feel it. So then the sensory part of the brain is not working well. Mm-hmm. So there's a lot of symptoms that can happen in the context of a TIA, and as I just said, depends on the location in the brain. But it's usually weakness, problems with sensation, problems with vision, or problems with language.
For a layman, the symptoms that you just described may also sound like a stroke-like symptoms. Could you tell us a bit of a difference between ischemic or TIA symptoms and the stroke-like symptoms?
Yeah, that's a very good question. And in fact, the signs and symptoms of patients with TIA and patients with a stroke are the same. The main difference is that patients with a stroke, they suffer from their deficits for a long time. So these are not the transient symptoms. So and these patients, if they come into the clinic, then it's for me as a clinician, it's so to say a little bit more easy, because these patients do have deficits at the moment I see them. I can examine them. The patients with a TIA, if I examine them, they don't have any deficits at all anymore. So I have to focus on the history taking and try to find out what happened the day before with them. So then I'm completely dependent on the history the patient on the complaints the patient is telling me.
You already started talking a little bit about diagnosis and how important it is to make a distinction between TIA and stroke. So could you now elaborate a bit more on how do you actually diagnose ischemia or TIA?
Yeah, very important question. And the main issue in making the diagnosis of a TIA is the sudden onset. Lots of people do have migraine. If you have problems with weakness or sensation in the context of a migraine attack, then the neurological deficit is developing slowly. It's coming there in a few minutes. It starts with the finger, and then it goes on to the arm, and then it goes to the face, and that takes a few minutes usually. So that's one of the important things. The TIA is a focal deficit. That's also important. The patient with a TIA has a completely normal consciousness. They do have a good memory of it, so they can. That's the main different for instance, with the patients who've had a trauma, and so they have a good memory. It's a focal deficit. They have a good memory, and as we call it, usually they have, so to say, negative symptoms, which means that it's not working anymore. You have negative symptoms and positive symptoms, and if you have a positive symptom, then, for instance, the arm is making little different movements. And or if you have problems with vision, then it's not that you are blind, but you see kind of flashes or moving things. And if you have these positive symptoms, then it's usually not a TIA, because a TIA is something with weakness, so you cannot move your arm anymore. It's not making jerking movements, but it's just weak. It's not moving anymore. Mm-hmm. So those are the three main things I would say from a TIA. Of course, it's transient, but it's focal, so it's a part of the body, a part of the brain, and there's a good memory, and it's negative symptoms.
And now I would like to ask you something more about the underlying causes and risk factors for developing TIA.
There are a few classes of causes, and one of the most important and most common is the atherosclerotic disease, which means that it's a narrowing of the main arteries that are bringing the blood to the brain. Mm-hmm. And another important cause is the heart. If you have a problem in your heart, for instance, with a valve of the heart or with the heart rhythm, then there's pooling of blood, and the pooling of blood will say that there's a high chance of getting a clot. And then the clot will go also upstream to the brain and make the blocking over there. And then there's also a problem with very small vessels in the brain. We call that small vessel disease. And then you have the very small arteries, or the arterioles, as we call them. And these are, then there's a problem, a local problem in the brain. So that gives a local problem with the perfusion of the brain. So it's not coming from the heart or from the artery, but it's in the brain itself. That's also a common cause of a TIA. And then there are very rare diseases, which is not, I think it's not important to cover them. And that's also important, in about, I would say 25%, we as neurologists do not find the cause.
Yeah, and then what about the risk factors? Perhaps maybe there is a gender that is more affected by developing TIA or something like that?
A very important question again. We do have a lot of so-called vascular risk factors. TIAs occur a little bit more often in men than in women, but I'm not sure if that's a real reflection of the reality. It can also be that men are coming more often to the hospital, and it may be dependent also on the risk factors. And the most important is hypertension. So that's a too high blood pressure. And as I just mentioned, the vessel wall is changing for the atherosclerotic plaque, and the vessel wall is prone to change if patient is having a too high blood pressure, if there's hypertension. So the hypertension kind of damages the vessel wall. So that's the one of the most important. And it's also a very, very difficult vascular risk factor because people don't complain about hypertension. And the other very important vascular risk factor is smoking, of course. And then there is diabetes. And diabetes is also having a damaging influence on the vessel wall, for mainly the small vessels, as I've just mentioned. And of course, there's the high concentration of lipids, as we call it, hyperlipidemia. And that's also a risk factor for vascular problems. Well, and then for the young people, also the drugs, ecstasy, cocaine. That's also important. That we know that it's very bad for your blood vessels. It's very bad for everything, but also for your blood vessels. And then there's one more, and that is obesity. So that's overweight. And that, so if patients have a too high BMI, BMI,
body mass index,
body mass index. If that's too high, then they have to work on that. That's also important. And in fact, that's also the main entrance for the treatment. We have to tell the patient that these are the risk factors. They have to control these risk factors because that is possible.
So you mentioned treatment, and lastly, I would like to ask you about the treatment options available, and also probably how could we prevent to develop a TIA?
Yeah, well, the most important thing is that the patient should go to the doctor. That's the most important preventive treatment, because if the patient is not going to the doctor cannot do anything. So if the patient is having had a TIA, he or she should go to the doctor. Well, then, dependent on the cause of the TIA, we treat patients with medications, and that's usually anticoagulants. And there's two types of anticoagulants. You can give medications working on the clotting process of the disease, or you can give medication that is inhibiting the platelet aggregation, so that the platelets that stick together. If the cause is in the heart, then we usually give anticoagulants. If the cause is in the atherosclerotic, so it's in the vessel wall, then we usually give antiplatelet drugs. So that's the difference. And of course, if there is a very severe narrowing of the carotid artery, then it's possible to ask the vascular surgeon to operate on the artery and to clean, so to say, to clean the artery and open the vessel and then remove the atherosclerotic plaque and then close it again so that the narrowing is not anymore there. So that's sometimes in about 10 to 15% of the patients we ask the vascular surgeons for help. And of course, if there's a problem with the heart valve or the heart rhythm, then the cardiologist should help us to cover that problem.
And regarding prevention, you said that a lot of lifestyle options are the ones that actually affect the development of TIA, right?
Sure, that's the most important thing, I would say. Everything I can do with medications or with surgery or things like that, they do not have the same influence as control of the vascular risk factors, as lifestyle. That's indeed, that's very important.
Mm-hmm. Well, thank you so much, Dr. Kappelle, for joining me today in our interviews with clinicians section of the Brain Olympiad 2022.
My pleasure.